The average American spends over $700 a year on dental products, professional cleanings, and routine procedures. The Amish spend almost nothing on any of that. They have been using a 5-ingredient paste that costs approximately $5 to make and lasts for months. Why the Amish never needed commercial toothpaste. Before getting into the recipe, it is worth understanding what the Amish approach to oral health is actually based on. It is not based on avoidance of dental care out of stubbornness or religious restriction. It is based on a preventive philosophy that prioritizes daily mechanical cleaning with materials that address the actual chemistry of tooth decay and gum disease at the source, rather than masking symptoms with synthetic flavoring and foaming agents. Commercial toothpaste was not introduced as a mass-market product until the late 19th century, and the fluoride-enriched versions that most Americans grew up using did not become standard until the mid-20th century. The Amish maintained the practices that predated those products because their daily oral hygiene routine produced results that gave them no reason to change, and because every ingredient in their paste was something they could produce or purchase locally without depending on a factory supply chain. The Amish relationship with oral hygiene is a practical demonstration that preventive consistency with the right materials achieves outcomes that most people assume require expensive professional products and regular clinical intervention throughout life. The chemistry of what actually causes tooth decay. The core chemistry of tooth decay is straightforward and has been understood for over a century. The bacteria in dental plaque feed on sugars and carbohydrates and produce acid as a metabolic byproduct. That acid dissolves the mineral content of enamel in a process called demineralization, which progresses into cavities when it outpaces the natural remineralization process driven by saliva. Gum disease follows a similar pathway, where bacterial accumulation along the gum line produces inflammation and, if unchecked, the breakdown of the supporting structures around teeth. Any effective dental care practice has to address bacterial load, acid production, and mechanical removal of plaque, and the Amish paste addresses all three with ingredients that have been chemically validated by modern dental research without any of them being invented or manufactured in the 20th century. Every component in that sequence was addressed by the Amish paste long before any laboratory confirmed the mechanism, because observational experience over generations produced the same conclusions that controlled research eventually documented at significant expense. Ingredient 1: baking soda. The first ingredient in the recipe is baking soda, and its inclusion is not a folk remedy with no scientific backing. The American Dental Association has recognized sodium bicarbonate as an effective toothpaste ingredient based on decades of clinical research. A comprehensive review published in the Journal of Clinical Dentistry evaluated multiple studies on baking soda toothpaste and found that it was significantly more effective at plaque removal than toothpastes without it, produced greater reductions in gingival inflammation over time, and its mild alkalinity neutralized the acid environment in the mouth that bacteria require for optimal growth and reproduction. The Amish have used baking soda as the base of their tooth powder and paste for generations because it works. And modern dentistry has spent decades of research resources confirming that the chemistry behind the practice was sound all along. The research consistently found no meaningful difference in safety or whitening outcomes between patients using baking soda formulations and those using conventional fluoride toothpaste without baking soda, while the plaque reduction advantage of baking soda formulations held across study populations. Ingredient 2: fine sea salt. The second ingredient is fine sea salt, or non-iodized table salt, which contributes to the paste through two distinct mechanisms. The first is physical abrasiveness at a level gentle enough to clean without damaging enamel, which augments the plaque removal action of the baking soda. The second is its osmotic effect on bacterial cells, where the high salt environment draws water out of bacterial cells through osmosis and inhibits their reproduction, reducing the overall bacterial load in the mouth over repeated daily use. Salt also stimulates saliva production, and saliva is the body's primary natural defense against tooth decay because it contains calcium and phosphate ions that directly remineralize enamel and antimicrobial compounds, including lysozyme and immunoglobulins that reduce bacterial populations independently of any cleaning product applied from outside. Combining both the mechanical and osmotic salt mechanisms with the alkaline environment from baking soda creates a genuinely hostile environment for the oral bacteria responsible for both cavities and gum disease, addressing the two primary pathways of dental deterioration in a single daily application. Ingredient 3. Coconut oil. The third ingredient is coconut oil, which serves as the binding agent for the paste while contributing antimicrobial properties that are documented in peer-reviewed research. Lauric acid, which makes up approximately 50% of the fatty acid content of coconut oil, has demonstrated antimicrobial activity against Streptococcus mutans, which is the primary bacterial species responsible for tooth decay in humans. Research published in the Journal of Contemporary Dental Practice examined the antibacterial activity of coconut oil against common oral pathogens and found meaningful inhibition at concentrations achievable during normal oral hygiene use. The oil's binding function in the paste also ensures good contact time between the baking soda and tooth surfaces during brushing, which increases the mechanical and chemical cleaning effectiveness compared to applying a dry powder directly to the teeth without a carrier. The combination of lauric acid's antimicrobial action with its binding and coating function in the paste creates a product that both cleans and leaves a temporary protective film on tooth and gum surfaces that extends some antimicrobial benefit past the brushing session itself. Ingredient 4. Clove essential oil. The fourth ingredient is clove essential oil, used in very small quantities of 1 to 3 drops per batch, which is where the recipe crosses from basic cleaning into genuine therapeutic application. Eugenol, the active compound in clove oil, has been used in professional dentistry as a local anesthetic and antimicrobial agent for over a century and is approved by the FDA for over-the-counter dental pain relief. The National Institutes of Health database contains substantial documentation of eugenol's antimicrobial activity against periodontal pathogens, including Porphyromonas gingivalis, which is the primary bacterial species associated with the progression of gum disease. Even at the very low concentrations present in a few drops of clove oil mixed into a batch of paste, the eugenol contribution provides measurable antimicrobial activity against exactly the organisms most responsible for the gum disease pathway that progresses silently until it becomes a costly clinical problem. Ingredient 5. Hydrogen peroxide. The fifth ingredient is hydrogen peroxide at 3% concentration, used in a small quantity to achieve paste consistency and to contribute whitening and antimicrobial action to the formula. The American Dental Association recognizes hydrogen peroxide as a safe and effective whitening agent at concentrations up to 10% when used as directed, and the 3% concentration in standard over-the-counter hydrogen peroxide is well within the safe range for regular oral hygiene use. Hydrogen peroxide releases oxygen when it contacts tissue, and that oxygen release creates an environment hostile to the anaerobic bacteria responsible for gum disease, which require the absence of oxygen to survive and reproduce effectively. The Amish use of diluted hydrogen peroxide in their oral care predates modern research on its mechanism by generations, but the underlying chemistry was working in their favor regardless of whether anyone had documented the science behind it. The complete recipe. The complete recipe combines 2 tablespoons of baking soda, 1 teaspoon of fine sea salt, 2 tablespoons of coconut oil brought to a soft consistency, 2 to 3 drops of clove essential oil, and enough 3% hydrogen peroxide to bring the mixture to a thick paste consistency, typically 1 to 2 teaspoons. Mix all ingredients thoroughly in a small glass jar with a tight-fitting lid and use within 6 weeks before the hydrogen peroxide loses meaningful potency. A single batch of this size provides enough paste for 2 to 3 months of daily use for one person, depending on quantity used per brushing session, and each subsequent batch costs under $1 from the ingredient supply purchased once at the start. The total mixing time, from ingredient measurement to finished paste in a sealed jar, is approximately 5 minutes. The cost comparison. The cost breakdown for the full ingredient supply needed to make repeated batches over a year is what makes this genuinely remarkable compared to the commercial alternative. A box of baking soda at $1.25, a container of non-iodized salt at $2, a small jar of coconut oil at $5 to $6, a bottle of clove essential oil at $4 to $5, and a bottle of hydrogen peroxide at $1. 25 cents totals approximately $14 to $16 for a supply that makes 12 to 15 batches over the course of a year. That is a full year of toothpaste for one person at approximately $1.25 per month, compared to the commercial alternative that runs $5 to $8 per tube at current Walmart pricing, with a tube lasting 4 to 6 weeks for one adult. The annual savings on toothpaste alone run between $40 and $80 per person in the household. The one honest limitation. The one limitation of this recipe that any honest presentation requires acknowledging is that it does not contain fluoride. And fluoride supplementation through toothpaste is a legitimate and scientifically supported cavity prevention measure. Fluoride integrates directly into the enamel crystal structure during remineralization, producing a harder and more acid-resistant mineral called fluorapatite that resists bacterial acid attack more effectively than natural hydroxyapatite. If you live in an area without fluoridated municipal water and you are concerned about fluoride intake for yourself or your children, using this paste as a primary cleaning product with a fluoride mouthwash as a complement is the approach that captures the benefits of both the traditional formulation and the validated protective chemistry of fluoride supplementation. That combination gives you the mechanical cleaning and antimicrobial action of the Amish paste alongside the remineralization enhancement that fluoride provides. The full picture of Amish oral health. The Amish approach to dental health is not built on the absence of any dental care. It is built on daily preventive practice so thorough and so chemically sound that the need for intervention is dramatically reduced compared to what most Americans experience across a lifetime. The $5 paste is one component of that, alongside dietary habits that minimize refined sugar exposure, oil pulling practices that further reduce oral bacterial load, and the kind of consistent daily routine that comes from treating oral health as a non-negotiable maintenance task rather than something addressed reactively when something starts to hurt. The recipe works, the science behind every ingredient supports it, and it costs less in a year than most people spend on a single tube of premium commercial toothpaste, without a single synthetic compound or artificial ingredient in the formula. Make a batch this weekend with ingredients you likely already have in your kitchen. Subscribe for the next video on the other Amish preventive health practices that mainstream medicine has recently started confirming were right all along. Drop a comment with which ingredient surprised you most.